In today's lecture, let us try to learn about general anesthetics. Before understanding the concept about general anesthesia, let us first try to understand what exactly anesthesia is. What is anesthesia? We'll try to discuss. And in anesthesia, we have so many classes, we have so many types of anesthesias. In anesthetic agents, we have general anesthetics, we have regional anesthetics, we have local anesthetics. Okay, that these different types of anesthesia are particularly suggested in different conditions based on the patient's condition, based on the disease condition, and based on the availability of the drug, and also based on the type of surgery which is to be performed in the patient. So based on all, so in today's class we'll try to learn all these parameters which are required to understand about anesthesia. Okay, anyway, see, first let me classify some types of anesthesias. Okay, in anesthesia, see, in anesthesia especially we have three types. Number one, general anesthesia. Okay, general anesthesia, this is first. Second one, we have regional anesthesia. This is very important. Most of us don't find these regional anesthetics in our pharmacology textbooks. These also we'll try to discuss. Okay, and the third one, we have local anesthetics. Local anesthetics, see, in regional anesthetics we have two more. It is again divided into two more types. One is the drugs which will cause neuronal block, and the drugs which will cause limbic block or limb blocks, limb block bolte. In neuronal block, we have two more types. One is epidural block, epidural block, and spinal block. Okay, or the drugs which will block, which are given in spinal cord, and the drugs which are given in epidural space of spinal cord. Okay, epidural drugs are given in epidural space of spinal cord. And in epidural anesthesia we have three more types: the drugs which are given in thoracic region, the drugs which are given in lumbar region, and the drugs which are given in caudal region. Okay, see, in neuronal blocks, in neuronal anesthetic agents, we have epidural and spinal. Epidural anesthetic drugs are given in epidural space of spinal cord, and in epidural we have three types. One is the drugs which are given at the site of thoracic region. The second, this is first one. And second one, the drugs which are given in lumbar region of the epidural space of spinal cord, and the third one, caudal region. Okay, these are three types of neuronal in epidural block. And in spinal drugs, the drugs are directly given in spinal cord. Okay, and in limbic block we have two more types. Try to listen carefully. All these types you should try to remember first. In limbic block, see, we have two limbs: upper limbs and lower limbs, right? The drugs which are given to block the actions or reflexes in the upper limb are called brachial plexus blocks, or the drugs which will block the brachial nerve or the brachial branch of the nerves. So these brachial plexus anesthetic drugs, what they do, they will block the upper limb reflexes. They will block the upper limb reflexes. And for lower limb anesthesia, we have lumbosacral blocks. Lumbar region bolte, lumbosacral plexus block. Okay, so these are all regional anesthesia, anesthetic agents. See, in regional anesthetic agents, what happens, the particular region, for example, we need some anesthesia at the particular tissue, at one tissue. For example, upper limb should be started with anesthesia. So in that case, regional anesthetic agents are given. We want to block the reflexes in the lower limb, total lower limb pura block ho jana chahiye. So in that case also we will give regional anesthetic agents. Okay, so in regional, these are different types or based on their location. And local anesthetics are those drugs which will directly inhibit the reflexes or actions at particular tissue. These are acting at tissue level. Local anesthetics are acting at tissue level. For example, see, I want to extract the teeth of the patient. एक पेशेंट के टीथ एक्सट्रैक्ट करना है, तो व्हाट आई डू, आई विल जस्ट स्प्रे द लोकल एनेस्थेटिक और आई विल जस्ट इंजेक्ट द लोकल एनेस्थेटिक एट द साइड ऑफ द टीथ. जो भी टीथ है वहाँ पे इफ आई इंजेक्ट, आई विल हैव anesthesia to the patient. So local anesthetics are those drugs which will cause anesthesia at particular place, local area. Okay, they are local anesthetics. Regional means they will cause anesthesia to the total region. For example, one limb, or in the upper limb or lower limb, or in particular point of tissues, a group of tissues, you can say, one organ, you can say. And general anesthetic drugs are those drugs which will cause total unconsciousness. Here general anesthetics will cause total unconsciousness of the patient. Okay, so in today's class we'll try to discuss about general anesthesia in detail. पूरे डिटेल में पढ़ेंगे इसके बारे में, उसका what is the definition, what are the clinical features, what important points we have to focus, what are general principles, all these things about general anesthesia we'll discuss in today's lecture. I think you understood the basic thing about what is general anesthesia, what is regional anesthesia and what is local anesthesia. Okay, anesthesia का definition अभी start नहीं किया है. Okay, just this, these are three types of anesthetic agents we have. Depend on the location, depend on the tissue, we need anesthesia. I think this point is clear to you. Now we will discuss about general anesthesia in detail. And just सुना सब लोग general anesthesia के बारे में. Okay, now you see, first very important point. See, general anesthetic agents are those agents which will simply cause CNS depression. General anesthetic agents are those agents which will cause CNS depression. Can we call general anesthetics as CNS? Because general anesthetics are causing CNS depression. See, along with this CNS depression, general anesthetics has few principles. Due to these principles, they are considered as anesthetic agents, not as CNS depressants. General anesthetics are having CNS depression action, but along with CNS depression action, they are having certain principles. Okay, that's why they are considered as general anesthetics. Now, see, simple general anesthetics are the drugs. Let me repeat. Listen carefully. General anesthetics are the drugs which will cause CNS depression, and this CNS depression will permit for the patient to perform surgeries. Let me repeat the point. See, I am telling the definition of general anesthetics. General anesthetics are the drugs which will cause CNS depression, which will permit for the patient to perform surgeries. Of CNS depressants in previous classes we have discussed. We have barbiturates, we have benzodiazepines, we have GABA analogs, gabapentins. Those drugs are also CNS depressants. But when those CNS depressants are given, we can't perform surgeries. To perform surgeries, some drugs should cause CNS depression and they should have some principles which will allow for us to perform surgeries. They are called general anesthetics. Okay, or general anesthesia. General anesthesia is nothing but loss of, अब देखो ये general anesthetics means the drugs which will cause CNS depression which will allow to perform surgeries. And general anesthesia क्या है? General anesthesia is different and general anesthetics is different. General anesthetics are the drugs which will cause general anesthesia. General anesthetics are the drugs which will cause general anesthesia. Now what is general anesthesia? What is general anesthesia? See, general anesthesia is the condition where patient will have, ध्यान से सुनो, general anesthesia is the condition where patient will have reversible unconsciousness. I am telling the definition of general anesthesia. General anesthesia का definition क्या है? The condition where the patient has reversible unconsciousness, number one. The condition where patient will have loss of consciousness, or loss of sensation. Reflexes होते रहते अपने बॉडी में, those sensations are lost. Okay, first in general anesthesia, first point is general anesthesia is the condition where patient will have reversible loss of consciousness or patient will have reversible unconsciousness. Second, patient will have loss of sensation. Third point, patient will have anesthesia, patient will have, we can say analgesia and amnesia. Patient will have analgesia, patient will have loss of pain, patient will have amnesia, patient will have loss of memory. These are 3 points. And next important fourth point, general anesthesia is the condition where patient will have muscle relaxation. Let me repeat the point. See, ध्यान से सुनो सब लोग, listen very carefully. What is general anesthesia? General anesthesia is the condition where patient will have reversible unconsciousness. General anesthesia is the condition where patient will have loss of sensation. General anesthesia is the condition where patient will have analgesic effect and amnestic effect. And general anesthesia is the condition where patient will have muscle relaxation. Total muscles will be relaxed. All smooth muscles, skeletal muscles, all muscles will be relaxed. So if patient has these 4 conditions, if patient has all these 4 conditions, that patient is in general anesthesia. And the drugs which will cause general anesthesia are called general anesthetics. The drugs which will induce general anesthesia are called general anesthetics. Are you all clear with this point? In this slide, what we discussed what is general anesthesia. General anesthesia is the condition where patient will have these 4 conditions. And we also have seen what is general anesthetic. General anesthetic is the agent, it is a drug which will cause general anesthesia. Okay. Okay, now see, one thing you all should understand. Just now I told general anesthesia is the condition where patient should have four conditions. See, in the market we don't have a single drug, a single drug to cause general anesthesia. We don't have a single drug to cause general anesthesia. That's why in causing general anesthesia, we have a protocol to be followed. That protocol is called anesthesia protocol. Anesthesia protocol. लेट मी रिपीट द पॉइंट, ध्यान से सुनो सब लोग. पेशेंट को जनरल अनेस्थीसिया कॉज करने के लिए we need to fulfill four objectives. Okay, to fulfill these four objectives we don't have a single drug. So in that case what we have to do, we have to follow anesthesia protocol to fulfill these four objectives. So to fulfill these four objectives we follow anesthesia protocol. Now what is anesthesia protocol? See, in anesthesia protocol, all remember carefully, listen carefully. In anesthesia protocol we have certain points. In anesthesia protocol we have to follow certain points because single drug is not available. So we have multiple drugs. To fulfill the objectives of general anesthesia. In that what we have to do, we have to follow anesthesia protocol. In anesthesia protocol we have pre-medication. We should give pre-medications, means the drugs which is given before anesthesia is obtained in the patient. In that we should give some muscle relaxants, we should give some anti-secretory agents, we should give some analgesic agents. Okay, so pre-medication, adjunct drugs करके बोलते हैं anesthesia के अंदर. सिंगल अनेस्थीसिया देने के बाद ऐसा नहीं छोड़ देना पेशेंट को. वी शुड नॉट लीव द पेशेंट. ऑलवेज वी हैव टू कीनली कीप मॉनिटरिंग द पेशेंट बिकॉज इन anesthesia protocol we have to follow all these things. First, what we have in anesthesia protocol, we should give pre-medications. Next, we have to give some drugs which will induce anesthesia. Inducing agents. Suddenly anesthesia नहीं आ जाता. Anesthesia induce होने के लिए we have to give some drugs. So this is the second point in anesthesia protocol. Next, we have to keep maintaining the anesthesia throughout the surgery. First we induce anesthesia. Next what we have to do, we have to maintain anesthesia. Anesthesia induce हो गया, उसके बाद maintain करना throughout the surgery. So this is third point in anesthesia protocol. And along with this we have to give some adjunct drugs. बीच में we have to keep monitoring the patient's heart rate, we have to keep monitoring respiratory rate, we have to keep checking the SpO2 oxygen concentration. All these things we have to keep monitoring. Okay, so these all parameters we have to keep checking throughout the surgery, and to maintain all these things we have to follow anesthesia protocol. So anesthesia protocol is required because there is no single anesthetic agent which is available for surgeries. To bring anesthesia or general anesthesia we don't have single drug. That's why we have to follow anesthesia protocol. I think you understood what is anesthesia protocol, why we have to follow anesthesia protocol, and why patient will have to follow all these things. Now you see, अभी सबसे important एक चीज I want to tell you, very important point I'm going to tell you. General principles of general anesthesia. These principles are particularly seen in general anesthesia only. They are not seen in local anesthetics. Okay, so why principles has to follow for general anesthesia, I'll tell you. See, very important point to follow principle. See, general anesthetic agents are narrow therapeutic in nature. General anesthetic drugs are narrow therapeutic in nature. Narrow therapeutic drugs are those drugs which will have very narrow therapeutic window. See, I think you all might have studied the pharmacokinetics. We see the when for example when drug is given to the patient, drug starts increasing its concentration in the body, right? So on the y-axis we will see the concentration of drug in plasma or in serum. Okay, mg per dl बोलते, or mg per liter or millimoles per liter जो भी है. On y-axis what we do, we see the concentration of drug in the body, and on the x-axis what we do, we see through time. At particular time what is the concentration of drug in the body. For example, see, when a drug is injected, suddenly what happens, drug will reach to particular concentration. After some time it will stay in the blood and slowly it will come down and it will be excreted. Okay, see, I would like to tell all our second year students here, you should try to know some basic points here. There is one concept called minimum effective concentration. I think you have heard. The concentration of the drug in plasma which will show the action in the body. Okay, that is called minimum effective concentration. See, this is minimum effective concentration. Just try to see, this is A and this is B, line A and line B. When the drug reaches to this point A, for example here, the drug concentration I'll take 5 mg per dl. Okay, when drug reaches in the plasma as 5 mg per dl, at that particular concentration, the drug will show its action. The drug starts showing its action. That is called minimum effective concentration. And when the drug reaches to the point B is called maximum effective concentration or maximum safe concentration. We can also say it maximum safe concentration. If the same drug crosses this point B, it is entering into toxic level. It is entering into toxic level, which is simply called as toxic level or toxic concentration. And the level and the range, see this range from A to B, the range between A to B is called therapeutic range. Therapeutic range. You understood what is therapeutic range. You understood what is minimum effective concentration. You understood what is maximum effective concentration. If drug crosses point B, which is maximum effective concentration, that means drug is at toxic level. If the drug is below point A, which is below minimum effective concentration, this level from A to here, this level is sub-therapeutic level. If the drug is in sub-therapeutic level, drug will not show its action. For example, if drug is at 4 mg per dl, 4 mg per dl में क्या है? Drug will not show its action. Action दिखाने के लिए minimum 5 mg per dl reach होना है. Just for example, I am telling these minimum effective concentration, maximum effective concentration. These concentrations varies from drug to drug. Okay. Anyways, you see. Now I want to tell you what is narrow therapeutic range or narrow therapeutic drug. See, the drugs which has very narrow therapeutic range. This range, for example, from 5 mg to 10 mg मान लो, 5 mg per dl to 10 mg per dl. If the drug is present in this range, that is therapeutic range. And the drugs which are having this range as very narrow therapeutic range drugs are called narrow therapeutic drugs. Here actually in narrow therapeutic drugs we have digoxin, we have antiarrhythmic drugs, we have some antibiotics like aminoglycosides, we have amphotericin B, okay, we have lithium, some antidepressants, we have antipsychotics, we have immunosuppressants like methotrexate. All these drugs are having very narrow therapeutic window. Their therapeutic range is very small. That's why they are called narrow therapeutic drugs. And there are some drugs which has wide therapeutic window. Wide therapeutic window means this range, the drugs which has very bigger range. The range between A to B is very big. Those drugs are called wide therapeutic drugs. Okay, I think you understood what is narrow therapeutic window. The drugs which has narrow therapeutic window are called narrow therapeutic drugs. Now you see, when narrow therapeutic drugs are given, always we should keep monitoring that that drug should stay in the therapeutic range only. If slight alteration in the drug, if slightly drug concentration is high, what happens? Immediately it will reach toxic level. If slight drug concentration is decreased, slight dose is decreased, the drug will reach into the subtherapeutic range. When the drug is in subtherapeutic range, drug will not show its action. When the drug reaches to the toxic range, it will show lethal adverse drug reactions. So to overcome adverse drug reactions and to overcome subtherapeutic actions, we have to keenly monitor narrow therapeutic drugs so that they are maintaining in the range only, therapeutic range only. And this maintaining of therapeutic range is very challenging for clinical pharmacist. एक ड्रग को therapeutic range के अंदर रखने के लिए we have so many challenges. So what we have to do? We have to keep checking the drug interactions. We have to keep checking the blood concentrations of the drug. Okay, we have to advise the drug particularly before food or after food. Okay, and we should keep checking the adverse drug reactions to the patient. We have to keep checking the pharmacodynamic actions of the drug. All these things we have to keep checking to the patient. Okay, see, general anesthetic drugs are having narrow therapeutic window. Clear? Due to this narrow therapeutic window, slight increase in the dose may cause lethal toxic effects, and slight increase in the dose. If slight decrease in the dose may cause subtherapeutic level. If patient is at subtherapeutic level, what happens? Anesthesia दे दिए, सर्जरी शुरू कर दिए और सबथेरेपेटिक लेवल में चले गया, तो इमीडिएटली व्हाट विल हैपन? पेशेंट कॉन्शियस में आ जाएगा, पेशेंट विल बी इन कॉन्शियसनेस, पेशेंट उठ जाएगा और पेशेंट पूरा देखने लगेगा कि यस सर्जरी जो हो रहा है पूरा देख लेगा पेशेंट, और पेशेंट को एंजाइटी आ जाएगी, पेशेंट डर जाएगा. मिनी लिथल कॉन्सिक्वेंस, दैट इज वेरी डेंजरस. अगर सर्जरी के बीच में पेशेंट को कॉन्शियसनेस आ गया ना, दैट इज वेरी डेंजरस. आई विल टेल दैट आल्सो व्हाई इट इज डेंजरस. Okay, so we have to make sure the drug is not coming to the subtherapeutic range. We also have to make sure that drug is not entering into the lethal toxic level. If drug enters into toxic level, what happens? Patient will have respiratory depression, patient will have very low blood pressure, patient will go to coma. पेशेंट मर जाता, कोमा में जाके मर जाता इफ स्लाइटली डोज इंक्रीज हो गया तो। ओके, ये कोमा में क्यों जाता है ये सब आई विल टेल यू दी stages of anesthesia. In that I will explain you how all these things happens. Okay, now you see, in general principles we were discussing general principles. Like first general principle is general anesthetics are narrow therapeutic drugs. So what we have to do, we have to monitor dosage. This is first general principle. First principle क्या है, we have to monitor the doses. We have to decrease the adverse drug reactions by decreasing the toxic level, or when the patient is having subtherapeutic level we have to slightly increase the dose and we have to maintain therapeutic range. ड्रग का therapeutic range maintain करते रहना. First point clear. Now second point, ध्यान से सुनो सब लोग. Second general principle of general anesthesia is general anesthetic agents will cause hypotension. They will cause hypotension. Why general anesthetics will cause hypotension? Why general anesthetics will cause hypotension? Because general anesthetics has direct vasodilatory action. They have direct vasodilatory action. They decreases cardiac output by decreasing the force of contraction. They depresses cardiac myocytes. Okay, cardiac actions कम कर देगा. General anesthetics will decrease the baroreceptor activity. We have baroreceptors in the blood vessels, right? Blood vessels के अंदर baroreceptors है. When blood pressure increases, baroreceptors will be activated and due to feedback mechanism they will be dilated. When baroreceptors are, when patient has hypotension, they will be constricted. Okay, constriction and vasodilation is mainly caused due to baroreceptors. Okay, so baroreceptors are very important, which maintains blood pressure, especially in hypertension. These will try to maintain. So general anesthetics क्या करेंगे? General anesthetics will decrease the baroreceptor activity. They will alter the baroreceptor activity. Through that, patient will have hypotension. Very, very important. General anesthetics will cause hypotension. General anesthetics will cause hypotension. See, this is second principle. I am repeating the points. Why? Because you will remember properly. That's why. See, if patient is already on general anesthesia and patient is already having hypotension or patient is having history of hypotension, it is very challenging. For a clinical pharmacist, it is very challenging to maintain patient's patient's blood pressure in general anesthesia, because patient is already at hypotension and general anesthetics again they will cause hypotension. So patient फिर hypotensive crisis में जा सकता है. That's why it is very challenging. So this principle is very important. And sometimes patients are having myocardial infarction. Patients will be having congestive heart failure. Myocardial infarction, congestive heart failure. In these cases, patient may again have cardiac depressive action and patient again may have hypotension. So myocardial infarction and congestive heart failure patients with general anesthetics are not suggested. Okay. And sometimes what happens, due to lengthy surgeries or due to complicated surgeries, more blood loss is seen. In that cases what happens, patient will have volume depletion. Patient का volume deplete हो जाता है and patient will again have to face hypotension. So again another point. So second general principle is we have to keep maintaining the patient's blood pressure. We have to monitor patient's hypotension, because general anesthetics will cause hypotension. If already patient is having hypotensive crisis or hypotensive states or hypotensive risk factor, in that cases we have to monitor patient's blood pressure very, very keenly. This is second principle. Clear? Now third principle of general anesthesia. नैरो थेरेपेटिक है तो नैरो थेरेपेटिक लेवल मेंटेन करना, थेरेपेटिक लेवल मेंटेन करना. If patient has hypotension, we have to maintain hypotension. We have to maintain blood pressure. Third principle is very important. Respiratory effects. General anesthetics का respiratory system के ऊपर action क्या है? What is the action of general anesthesia on respiratory system? Simple point. General anesthetics will stop, or general anesthetics will decrease the airway patency. And third important principle, general principle of general anesthesia is, in respiratory system, general anesthetics will decrease airway patency. That means they will decrease passage of airway. They will decrease the patency. जो open था, always respiratory system should be opened. Always the respiratory tract starting from the trachea, primary bronchiole, secondary bronchiole, tertiary bronchioles, alveoli, all these branches, all the tubes should be patent. They should be patent always. If they are patent, exchange of gases can be easily seen. If patency is decreased, exchange of gases is not properly exchanged. So general anesthetics, what they are doing, they are decreasing the airway patency. Through that, it will cause respiratory depression. So this is very, very important. So in respiratory, general anesthetics are having much risk of causing respiratory depression. Airway patency रोक देगा, आई मीन एयरोपेटेंसी को कम कर देगा। तो इन दिस केसेस व्हाट वी डू, वी विल परफॉर्म endotracheal intubation. Endotracheal intubation, simply it is called intubation. Do you know about endotracheal intubation? Have you heard about this term anywhere, anytime? About this I'll explain. चलो, see, endotracheal intubation के बारे में I'll explain in upcoming slides, it will come. Okay, इसका ट्रीटमेंट भी है, ये वही endotracheal intubation is done. जनरल एनेस्थीसिया में क्यों करते हैं, दूसरे कौन से कंडीशन में यूज करते हैं, और इसका प्रोसेस क्या है, ऑल I'll explain. Okay, टॉपिक पूरा इधर उधर चले जाता है. Anyways, चलो, see, third general principle is general anesthetics. What they do? They will decrease the patency, airway patency. So what we have to do, being a clinical pharmacist, we have to make sure that general anesthetics are not causing respiratory depression. Respiratory depression should not be seen in general anesthetic patients. This is third principle. Fourth principle, very important principle. See, general anesthetics will cause, they will cause gag effect pathway. They will decrease gag effect. They will decrease gag effect. How many of you know about gag effect? GAG, gag effect. Gag effect or pharyngeal reflex. Pharyngeal reflex. Very good, very good. Pharyngeal reflex, gag reflex भी बोलते, gag reflex. Which is, let me try to explain you with a small diagram. See, okay, just imagine this is nasal cavity. Okay, nasal cavity. This is buccal cavity. ध्यान से सुनना सब लोग, गैग रिफ्लेक्स के बारे में बता रहा हूँ अभी. वैदिक गौतम already he told, but let me give you some more clarification. Okay, see, this is nasal cavity. I will rub the ear external parts. Nasal cavity, and this is buccal cavity. Buccal cavity जो भी खाना वाना खाते पीने, all will enter from the esophagus. It is entering into the esophagus. यहाँ है esophagus. And from the nasal cavity, actually here it is nasal cavity and buccal cavity, both are having same junction. They are having same opening at the same junction. Here what happens, from the pharynx here, one opening is there which is entering into the trachea. Okay, through the it is entering into the lungs, and this trachea is having one lid like structure which is called epiglottis. The opening of the trachea is glottis, and the lid like structure which is called epiglottis. Okay, ध्यान से सुनो, glottis and epiglottis. Glottis is the opening of trachea, and the lid like structure which closes the glottis is epiglottis. Okay, and here we have one more passage which is entering into the stomach through esophagus. This is esophagus, this is esophagus, this is trachea. Okay, when the muscles of buccal cavity, muscles of pharynx, while explaining about the anatomy of pharynx in previous class, in first year anatomy, I was explaining you pharynx muscles are very strong. When the pharyngeal muscles are contracted, immediately the epiglottis will be closed, and the food particles, the water particles, everything will be swallowed through the esophagus, and they will be entered into the stomach. I explained this point. The reflexes of the contractions of nasal cavity muscles, buccal cavity muscles, the what we say, we have all the muscles of the tongue, all these muscles, when they contract, it will mediate the swallowing of the food into esophagus. This reflex or this action is called gag effect. See, gag effect is nothing but swallowing activity, the contractions of pharyngeal muscles. When pharyngeal muscles are contracted, immediately the epiglottis is closed. Epiglottis is closed. So when gag effect is seen, what will happen? Food particles will enter into the esophagus but not into the trachea. Gag effect क्या करेगा? Gag effect is allowing the food particles into the esophagus but not into the trachea. This is the gag effect. But general anesthetics, what they are doing? General anesthetics are decreasing the reflexes of gag effect. When gag effect reflexes are decreased, what will happen? The swallowing ability of the patient will decrease. So in that time, what happens? The swallowing ability decreases. Whatever fluid particle, saliva, the liquid, whatever your buccal cavity has, that all the components will try to enter into, they will enter into trachea, and they will cause aspiration, which will further lead to aspiration pneumonia, which is very dangerous condition. जो भी अपन swallow करते, the swallowed particles should enter into esophagus. They should not enter into trachea, and this effect is maintained by gag effect, which is also called pharyngeal reflex. Gag reflex भी बोलते. But general anesthesia क्या कर रहा? General anesthetics are decreasing the gag effect. They are losing gag effect. They are decreasing pharyngeal reflexes. So the fourth general principle is very important, to maintain gag reflexes. So here, to maintain gag reflex, again the patients are performed with endotracheal intubation. This is fourth principle. Now, fifth principle, another very important point. See, fifth principle, the general anesthesia will decrease the cuff sensitivity. Cuff sensitivity. Simply it will decrease the cuff stimulation. Cuff stimulation पूरा कम हो जाएगा. When do we have cough? When something is having obstruction into the pharyngeal or in the larynx. In the larynx के पास अगर कुछ any particle is obstructed, patient will have cough, and that will be removed either through buccal cavity, or it will be transported to the esophagus, and from there it will be entered into the stomach. This actually, cough is defense mechanism. It is a defense activity which will clear the obstruction. But general anesthetics, what they are doing, they are decreasing the cuff sensitivity. This is fifth general principle. Now, sixth principle, ये सब पूरे ध्यान से सुन लो, ध्यान से you have to remember. Now, another very important point, sixth principle, general anesthetics will try to decrease the lower esophageal sphincter tone. Very, very important. I think you all know about upper esophageal sphincter, lower esophageal sphincter. Do you know all this? We have pyloric sphincter. सुने कि नहीं? सुने कि नहीं? Are you all listening to me? See, this is esophagus, stomach, small intestine. Esophagus, stomach, duodenum, small intestine. Okay. See, here we have sphincter. This sphincter which is closely present at the stomach is lower esophageal sphincter, and the sphincter which is present above, just above the esophagus, which is called upper esophageal sphincter. From the upper esophageal sphincter, the food particles will enter into esophagus. From esophagus, the food will enter into stomach through lower esophageal sphincter. Okay, and from the stomach, when it is entering into the duodenum, here we have one more sphincter which is called pyloric sphincter. Pyloric sphincter, SPINCTOR. See, actual point क्या है? The general anesthetics will decrease the tone of lower esophageal sphincter. ये जो lower esophageal sphincter का tone है, tone means contraction. When the sphincter contracts, it will be closed. When sphincter relaxes, it will be opened. ध्यान रख लो, sphincters contract मतलब it will close. Contract, CC, contract means close. When sphincter is relaxed means opened. So what general anesthetics are doing? General anesthetics are relaxing. General anesthetics are relaxing lower esophageal sphincter. If lower esophageal sphincter is relaxed, it will be opened. Then what happens? Can anyone tell me the answer? Why? What happens if lower esophageal sphincter is relaxed? अगर lower esophageal sphincter relax हो गया तो क्या होगा? Anybody from the class? GERD, very good. Gastrointestinal reflex हो जाएगा, बाहर पूरा esophagus में आ जाएगा. The gastric content, the acidic content, all the acid, what it does, it will flow back into the esophagus, which is called regurgitation, which will further cause chest pain, which will further cause chest burning sensation, vomiting हो जाएगा, aspiration हो जाएगा, very dangerous condition. Understood? Sixth principle, general principle of anesthesia. In general anesthesia, general anesthetics are having ability to cause lower esophageal sphincter relaxation, so we have to monitor this lower esophageal sphincter also. So general anesthesia देने से पहले ये सब कैसा कैसा करना, I will explain everything while explaining about the treatment. Okay, and now one more principle I want to tell. 6 principles. Okay, now I'll explain about the 7th principle. I am going very slowly because अपने पास बहुत time है, फटाफट भाग लो नहीं. 7th principle of general anesthesia. General anesthetics will cause hypothermia. General anesthesia will cause hypothermia. What is hypothermia? Decreased body temperature less than 36 degrees Celsius, which is called hypothermia, which is very dangerous condition. If patient experiences hypothermia, all the enzyme activity decreases and patient may go to coma and patient will die. Very dangerous. So hypothermia, why general anesthetics causes hypothermia? Because in general anesthesia we keep giving IV fluids. In general anesthetics, agents will decrease the basal metabolic rate, मेटाबॉलिक रेट पूरा कम हो जाएगा. जनरल एनेस्थीसिया will decrease oxygen consumption. When oxygen consumption is decreased, all muscles or all the tissues will not show metabolism, and through that heat production is decreased. Heat production is decreased. And another very important point, general anesthetic agents will decrease the thermoregulatory center. Thermoregulatory center activity को alter कर देगा. With these also, the patient's temperature is not maintained and patient will go to hypothermia. So this is the seventh principle. Seventh principle is general anesthetic agents will cause hypothermia. That is because patient will be having heavy fluids. It decreases basal metabolic rate. Oxygen consumption is very less in general anesthesia. Heat production is less, and it also alters the thermoregulatory center in the brain. With that, it causes hypothermia. Now, last one principle is there, which is very, very important principle. All these principles you have to remember. Each principle is very important. While explaining about the drugs, you have to remember all these things. Now, next general principle of general anesthesia is the eighth one, I think, eighth principle. Remember, general anesthesia will cause nausea and vomiting. Simple. Because they have direct effect on chemotrigger zone. Okay. They have direct action on chemotrigger zone and it will induce vomiting. So general anesthetics will cause vomiting. And one more point, general anesthetics will induce 5-HT. They will cause or they will potentiate the actions of hydroxytryptamine. It potentiates the actions of histamines. It causes the actions of acetylcholine, which will mediate nausea, vomiting. It increases dopamine activity and also NK1 receptor activity. NK1 receptor activity. NK1 receptors are present in central nervous system. All these 5-hydroxytryptamine, chemotrigger zone, acetylcholine in the central nervous system, dopamine, all this activity is elevated. Through that, what happens? General anesthetics will cause severe nausea and vomiting. General anesthetics will cause severe nausea and vomiting sensation. Nausea and vomiting is caused by general anesthesia. Why? Because it is potentiating the actions of 5-HT, histamines, acetylcholine, dopamine, and NK1 receptors. NK1 or neurokinin 1 receptors. Okay. So to stop this, we can either give antiemetics. We can give NK1 receptor antagonist. NK1 receptor antagonist करके newer drugs we have. These are actually NK1 receptor antagonist are used in migraine. Migraine study करते करते they studied NK1 receptors activity. Antagonist can be used to decrease nausea and vomiting. And in NK1 receptors, can anyone tell me the examples of NK1 receptor antagonist? We have aprepitant, and rolapitant. These are available in oral form actually. These aprepitant, these are NK1 receptor antagonists. Along with this, we can give other antiemetics like 5-HT3 receptor antagonist, ondansetron, very famous drug. Ondansetron. We can go with antihistamines. We can also go with anti-secretory agents. Anti-motility, anticholinergic जैसा एक drug है, metoclopramide. These drugs can be given. Metoclopramide is suggested actually. General anesthesia में metoclopramide what it does? It will increase the movement of gastric substances downwards. Stomach से intestine से large से it will potentiate movement. पीछे नहीं आने देगा metoclopramide. Okay. And it is also having some anti-principles of general anesthesia. I think you all understood these principles. Clear everybody? इसमें किसी को डाउट है तो अभी पूछो. Now, okay. Now we will go back to the mechanism of action of general anesthetics. Now we will discuss about the mechanism of action of general anesthetics. See, this mechanism is particularly for general anesthetics, not for local and not for other. Okay. Anesthesia में we have discussed 3 types. One is general anesthesia, one is regional anesthesia, and one is local anesthesia. We are discussing about general anesthesia only. ये जो general principles थे वो सब general anesthesia के हैं. They are not for local anesthesia and not for others. Okay. So mechanism of action of general anesthesia. General anesthesia के 4 points you should not forget. General anesthesia cause करने के लिए 4 actions it should fulfill. If any drug which fulfills or if anyone causes these 4 objectives, that means they are general anesthetics. But single drug is not there for general anesthesia anyways. Now you see, till now there are so many theories for general anesthesia, and till now we don't know exactly general anesthesia कैसा होता ब्रेन के अंदर. We don't know exactly ब्रेन के अंदर जनरल एनेस्थीसिया. अभी तक जो पूरे के पूरे वी डिस्कस्ड नो ऑल द प्रिंसिपल्स. एग्जैक्टली एक जनरल एनेस्थीसिया देने के बाद ये सब कैसा होता किसी को नहीं पता. बट वी नो सम मैकेनिज्म्स थ्रू study of certain neurotransmitters. Number 1, first mechanism of action of general anesthesia is, see, general anesthetics will increase the GABA activity. in brain. In previous classes we discussed, just let me draw one single nerve. This is a single nerve which is present in brain. Okay, this nerve is releasing some neurotransmitters. This brain will send information to, or this nerve will send information to the other nerve, and this nerve will send information to tissue, and from tissue to this nerve, and from this nerve to this nerve, and here the information will be processed in brain. All these things, reflexes and actions, we already know. Now you see, just imagine this is nerve A and nerve B, or this is presynaptic nerve or postsynaptic nerve, कैसा भी ले सकते हैं अपन. When neurotransmitter is releasing here somewhere here from the previous nerve or presynaptic nerve, it should go and bind on the receptors, right? And when these receptors are activated, further the information is passed to the next nerve. ये तो सबको पता है. Okay, see, when information is passed from one nerve to the other nerve, in that we have certain neurotransmitters which are called excitatory, and certain neurotransmitters are called inhibitory. Here general anesthetics, what they do, they will increase the action of GABA, which is a inhibitory neurotransmitter. For example, just imagine here GABA is released. This GABA will go and act on GABA A receptor here. GABA receptor के बारे में, GABA subunits, all the actions in previous classes we discussed. I will not go in detail in this. Okay, when GABA releases in the synapse and when it falls on the GABA receptor, what it does, it will cause hyperpolarization of this nerve and the information will stop here itself. So when GABA activity is increased, what will happen? Brain will be depressed. GABA activity अगर ज़्यादा हो गया तो क्या होगा? Brain पूरा depressed हो जाएगा and patient will go to sedation, hypnosis, and patient also will have anesthetic effect, analgesic effect, anesthetic effect, ये सब होगा. So first mechanism of anesthesia is it is increasing the activity of GABA. Clear? First mechanism of general anesthesia is decreasing, it is increasing the activity of GABA in the brain. What is the action of general anesthesia? It is, first point, it is increasing the activity of GABA in the brain. Next, another important point, it will decrease the actions of NMDA receptor. Actually, this N-methyl deaspartate receptor is excitatory receptor. This receptor is activated on aspartate or glutamate. Glutamate and aspartate both are, this especially glutamate, these are aspartate and glutamate are excitatory neurotransmitters. When they fall on NMDA receptor, NMDA activates and it will further send the information to the tissues. Sorry. So general anesthetic agents, what they are doing, they are decreasing the actions of NMDA receptor. When NMDA receptor activity is decreased, what will happen? Patient will have anesthesia. This is second mechanism. Now third mechanism is, see, for the propagation of neurotransmitters, in previous class I told, just imagine this is a nerve. Okay, for the propagation of nerve activity, the nerve should be depolarized first. The nerve should be depolarized by entry of either sodium or potassium channels inside the cell. Okay, positive ion अंदर जाना चाहिए first. So sodium and potassium ions first enters into the nerve, it will depolarize. When this nerve is depolarized, it will release information here, and again the information will be propagated to the further nerve. And when the nerve comes back, in the back process is very similar. So here the sodium and potassium ion channels are very important for propagation of nerve impulses. So general anesthetics, what they are doing, they are blocking the sodium and potassium channels also. So sodium potassium channels are blocked, NMDA receptor is blocked, and GABA activity is increased. These three mechanisms, they are causing anesthesia, or they are losing the consciousness of the body totally. ये सब कहाँ पे हो रहा? Mainly all this GABA activity, NMDA activity, and sodium potassium activity, all these activities are particularly seen in the brain. That's why they are called general anesthesia. Brain अगर depress हो गया, initially I told one point, general anesthetic agents or CNS depressants. Simple. General anesthetics or CNS depressants. Why they cause CNS depressant? By these three mechanisms. Number one, they increase GABA activity. Number two, they decrease NMDA activity, and they stop or they block the sodium and potassium channels in the brain nerves. Through this, they will block activity in the brain, and through that they will maintain anesthesia. Mechanism of action of general anesthesia समझ गए सब लोग? In previous classes already we have discussed about NMDA receptor, GABA activity, sodium potassium channels. पूरे के पूरे in while explaining about epilepsy and seizures, I explained all those points very clearly. That's why I'm not explaining in detail. Okay, I think you understood the mechanism. Now we'll go with the classification of general anesthesia. In classification of general anesthesia, usually we have two types. One is inhalant drugs and the second we have parenterals. Inhalants means these are given through nasal cavity as gases, and parenteral drugs are directly injected into the veins. Okay. In inhalants we have volatile liquids and gases. Volatile liquids, what they do, they are very volatile in nature and they form gases. Volatile liquids always form gases. So in volatile liquids we have halothane, isoflurane, desflurane, sevoflurane and ether. And in gases we have nitrous oxide, N2O, which is also called laughing gas in short. Okay, so these are inhalant general anesthetics. And in parenterals we have propofol, very important. So these are inducing drugs actually. In parenterals we have inducing drugs and few are maintaining drugs or slow acting drugs. These are maintaining drugs. These are inducing. And inhalants, these are also sometimes used as maintenance drug. So in inducing drugs we have propofol, etomidate, thiopentone, methohexetone. And in slow acting drugs we have benzodiazepines, diazepam, lorazepam, midazolam, ketamine, and few opiates also. All these are slow acting drugs and maintaining drugs. So these are the different drugs which are used as general anesthetics. I think this classification is clear to you. And see, these are local anesthetics. These are local. ये local anesthetics के बारे में डिटेल में अपन बाद में पढ़ेंगे. Okay, I'll explain each and everything in detail. Why local anesthetics are used, why not general anesthetics. So I will explain about stages of anesthesia and I'll stop here. My larynx is not supporting. Okay, so stages of anesthesia. See, in anesthesia stages, for example, when a anesthetic drug, for example, when inducing drug is injected into the blood, it reaches into the brain and it will show its action, right? Immediately patient will not reach into fourth stage, third stage. Suddenly नहीं होता. It has stages. Anesthesia में stages है. In that we have 4 stages. ध्यान से सुनो. In anesthesia we have 4 stages. Stage 1, stage 2, stage 3 and stage 4. First stage of anesthesia is, see, patient when drug is injected, patient को conscious रहता है. Patient is at consciousness only and slowly patient will be having drowsiness. Injection देते ही or when inhalant is given, slowly patient will start sleep. Drowsiness रहता, but here total sleep is not there. Patient will have conscious. अंदर क्या हो रहा है, सराउंडिंग्स में क्या क्या चल रहा है, सब पेशेंट को दिखते रहता, बट पेशेंट इज स्लाइटली ड्राउजी. ओके, व्हेन यू टेक लॉट ऑफ सिट्रिजिन, व्हेन यू टेक सिट्रिजिन टैबलेट, व्हेन यू सिट इन द क्लास में क्या क्या चल रहा है सब पता रहता, लेकिन कॉन्शियस में, लेकिन यू नथिंग विल बी. फॉर एग्जांपल इफ टीचर इज टीचिंग समथिंग, टीचर क्या समझा रहे कुछ ब्रेन में चढ़ेगा नहीं, बस टीचर विल बी वॉकिंग हियर एंड देयर, टीचर विल बी टॉकिंग, फ्रेंड्स विल बी टॉकिंग, ये सब चलते रहता, बट यू आर ड्राउजी. ओके, दैट इज स्टेज 1. स्टेज 2 इज वेरी इंपॉर्टेंट. पेशेंट विल बी एक्साइटेड. स्टार्टिंग में ड्राउजी था, सेकंड स्टेज में एक्साइट हो जाता पेशेंट हियर इन एक्साइटेशन में पेशेंट विल लूज कॉन्शियसनेस, बट पेशेंट सिंपैथेटिक एक्टिविटीज है, हार्ट रेट बढ़ जाता, ब्लड प्रेशर बढ़ जाता, पीपल्स विल बी डायलेटेड, मसल टोन इंक्रीजेस, पेशेंट स्केलेटल मसल्स विल इंक्रीज, पेशेंट्स ब्रीथिंग इज इरेगुलर, ब्रीथिंग रेट, हार्ट रेट, पल्स रेट, रेस्पिरेटरी रेट पूरे बढ़ जाते. ओके, हियर इन स्टेज 2 इट इज वेरी वेरी डेंजरस टू परफॉर्म सर्जरी. यहाँ पे सर्जरी नहीं करना चाहिए अपन. एक्चुअली ये फर्स्ट स्टेज सेकंड स्टेज में दोनों में नहीं करना चाहिए. It is not suitable. Okay, this is second stage. Third stage of anesthesia is very important. Here second stage के बाद immediately patients respiratory becomes normal, muscle relaxation becomes normal. I mean muscles पूरे relax हो जाते हैं. Here muscles were contracted, here muscles will relax. Reflexes will be lost here. Reflexes means, reflexes यहाँ पे, if see, reflexes are those actions which are caused instantly. Okay, ये reflexes are not seen. Intercostal muscles are paralyzed. Respiratory muscles बोलते. Okay, respiratory intercostal diaphragm muscles paralyzed नहीं होते, but intercostal muscles paralyzed होते, and pupils will be dilated and eyeballs are fixed. This stage is best for surgery. And fourth stage is respiration and vasomotor center are depressed here. ये अगर fourth stage में patient गया, patient may die. Simple. See, stage 1 is patient is at subtherapeutic level. Stage 4 is patient is at toxic level. So always we should not allow the patient to go to toxic level or fourth stage. Fourth stage पे गया तो क्या होगा, सेंट्रल नर्वस सिस्टम पूरा डिप्रेस हो जाएगा, कोमा में चले जाएगा, and patient will die. So always we have to keep monitoring the general anesthetic drug concentrations while it is given to the patient. So we have to keep following the anesthesia protocol. Anesthesia protocol क्या है, कैसा फॉलो होना, ये सब. In next class I'll explain the further concepts about each drug pharmacology, their adverse effects, their indications, drug interactions, important points, precautions, sub we'll discuss in the next class. Okay.